This is a patient in his mid-20s that has been grinding his teeth. On visual examination of the x-rays, there's really nothing major going on. His fillings seem to be holding up fairly well. A little bit of wear, but nothing significant. There's no really major bone loss. And this is what you would typically find in somebody in their mid-20s that is taking good care of his teeth. The actual filling on number 15 in the back has a little flash on it, but nothing significant, and that's from a chip accident when he was younger. There's his lower front teeth. You can see that they don't look like they're worn down in an amazing amount, but as we take a look at his teeth, we'll notice that there's a little more chips and edges. The other issue that's going on in the patient's mouth is he has a little bit of gingivitis. You can see how the gum tissue moves around a little bit, and easily enough corrected in terms of being able to floss on a regular basis. In about 6 weeks, that would look significantly better. On a close-up, you can see the wear faceting on his lower teeth. You can also see the straight canine there that's been worn down a little bit, and the gingivitis that's also around the teeth there. There's the lower front teeth as well again. You see a little more of the faceting on both sides, the gingivitis as well. Tooth number 19. His lower first molar has a little bit of cavity there. We're taking a look at also the premolars in front of it, and those look pristine and no real problems. This patient's really good about removing plaque, and does have tartar though. And you can see the calculus or tartar that's on his teeth, and which everybody gets. It's not a really major problem in his mouth, and just getting it professionally cleaned periodically will take care of it. See the canine where he's really worn down the tooth fairly significantly, and this is the other side of the mouth that people don't normally see. There's the little filling that we'll go ahead and do. There'll probably be a video on that as well. You can see the little staining around as well near that cavity, and that shouldn't be anything major. Number 18, the lower second molar there has a little bit of stain around the filling. That's not a real problem. Probably will stay that way for quite some time, but it's good to be able to visualize it and make sure it's doing fine. The back of the tooth there has a little bit of an area that has chipped a little bit, and we'll see on the other side of his mouth, there's the little area that's gone. You also can look in the mirror and see the filling that has a little stain. This is tooth number 31. You can see where the aqua is, where there's a weak spot near the filling. Also a couple of other spots that may be possible cavities. You can also see when you look at the tooth as well that the back part of the tooth has been dished out, and there's been a little bit of grinding that's occurred there. Not a major amount, but it's just kind of a hint of what's going on in the patient's mouth. And over the years, that could get worse and possibly break or chip a tooth. Nice filling that was done here, a little bit of stain, but nothing really of concern. So we'll take a look at the upper teeth now, and a little same sort of thing, a little bit of stain around the filling. That could be that way for quite a long time. Is something that we'll keep an eye on and make sure that it doesn't get larger. And the x-rays seem to say that things were good as well. This one has even less. And it's very common to have stain in your mouth just naturally in the grooves, and it's not something that we typically worry about too much. There's the canine in the lateral, and you can see a little bit of wear that's occurred there. There's a little chip on the outside of his upper upper front tooth there, and you can see the metal retainer that keeps the two front teeth together. If this patient ended up not having that, there would be a space that would occur. He had orthodontia at an earlier age and found that whenever there was no retainer, that the teeth would separate. Here's the tooth number 15 that has the larger filling. Little bit of stain there, but the filling seems to be holding up. And just right at the edge of the tooth there, on the x-ray, we can see that there was a little bit of a overhang of composite. It isn't an easy enough thing to just polish down if we wanted to, and isn't anything of significance. Wanted to be sure that the staining didn't get any worse, and so that's turned out quite nice. Now, when we look at his front teeth, we do notice that there's a little bit of gingivitis going on. You can see that the tissue moves around very easily, and then also when we look at the very edges, you can see that there's just a little bit of a difference. They're not completely straight. There's a few little curves or nicks in them. You can also see some of the plaque that's on the lower front teeth there as well. We ask the patient to grind his teeth to the left, and you can see how it fits just like a glove there, particularly the canines, and now the front teeth as well. And you can see how that lines up perfectly, and it's like a little glove fit there. And if we go back and look at when we saw on the inside of the mouth, you can see that that's where the wear is occurring as well. Now, if you notice, the lower jaw is all the way over to the left significantly, and most people would say, well, no, I never do that. And when we look at his teeth, you can see how there's just a perfect fit, particularly on the two front teeth. Now, when he grinds to the other direction, we'll see the wear that goes all the way across and continues to wear on the upper two front teeth as well. And that's right where he ended up having the chip right there. And you can see how it's going through the lateral in that little groove there. And it's not enough for anyone to look at in a conversational distance and say, oh my goodness, you've been breaking your teeth. But on the other hand, over the years, if there's not protection, the patient will end up chipping and breaking his teeth. And by the time he's in his 30s, may end up having a significant problem. You can see how his teeth are further forward and line up right on that little groove there where the canine lines up, and that's not a typical spot that somebody ends up having their teeth be in. So it's most likely that he's doing this when he's asleep and not aware that this is what's occurring. There's the grinding pattern again when he goes off to the right. You can see how it's wearing off the canines. And we'll go ahead and see how, right now we're looking at just the upper right teeth there, just to make sure that there's not any major recession. It looks to be very good. And now we're going to check the bite to see where he first touches. And it turns out that when his jaw is in the most relaxed position, the very last tooth number 2, he touches. And you can see the black spot there. And he actually has like almost no spots. And there's that little black spot. He touches it first there. And when he does, that's the first spot. And then we'll take a look, and in a second we'll ask him to bite down, and then all his teeth will come together at one time like that. And we'd like to fix